Hello again. I am Josh Corman with the International Spa Association, and we are thrilled once again to be bringing you another video interview, this time with Amir Hematt of Zeel. He is Zeel's Senior Director for Public Health and Workplace Safety and has a rich and expansive background in all things PPE and public health. So Amir, I'm going to hand it over to you and let you kind of introduce yourself and give folks a sense of your background.
Sure. Hi, Josh. Pleasure to be here. A quick background. I went to medical school. I've completed graduate programs in public health and applied physiology. About 18 years ago, had a chance to work with the California State Legislature to do a number of things around policy and administration on the public health side, one of which was to handle the administration of funding and procurement for medical supplies, or PPE, for federally qualified health centers, the nonprofit hospitals and clinics throughout California known as the safety net. And it was during that time I had a chance to connect initially with a number of manufacturers, both in the United States as well as globally, especially in China. Prior to the pandemic, some of us who have worked in the space know that there was just about a handful, about six or so FDA certified manufacturers out of China. A great deal of PPE supplies were coming from there. So building manufacturing relationships, managing quality control and supply chain from the Asian markets, in particular China, was necessary. But with that experience, it's allowed me to be kind of well prepared for the period we're going through now, where I'm sure we'll discuss some of the challenges that come with the new environment. But certainly, in addition to navigating the purchasing or sourcing of products, the quality control and ensuring that the right types of products and supplies are getting into the hands of our workforce, and in particular our frontline workers, is ensured. So happy to be here with you today and hope I can be a resource to everyone.
I believe so, and we will definitely get to all that. I think for most of us 6 months ago, PPE might have been a fantasy football term if we were pressed to guess about it. But obviously now, it's one of those things that's top of mind really for people in a whole host of fields, definitely inside the spa industry. And as you mentioned, the period we're going through now, we've seen sort of this sharp spike in need. Obviously, demand has obviously risen really quickly, but with that spike in demand and now sort of a sustained demand, there are also, I'm absolutely sure, a ton of challenges when it comes to the things you just mentioned, right? When you're talking about procurement and just getting a hold of things, but also then the quality aspect of it. So, if you're on that side of the coin looking for PPE that you're going to be able to bring into a spa or a workplace and hand it over to employees or guests and have confidence that those things are going to work well and do what they're supposed to do, what are those challenges really that people are facing right now as they look out at a crowded market, a crowded landscape, and try to figure out, what they need as far as PPE goes?
You're absolutely right. Prior to 6 or 7 months ago, especially in the United States, PPE was not a term many folks were familiar with, and the category on the whole was very much under the radar. And even in my own case, this particular piece of my professional background was sort of the overlooked and underappreciated aspect. And so things have changed dramatically. And part of the reason that I started getting contacted by government entities or even manufacturers overseas was because one of the biggest challenges is first and foremost trust. And that's trust from both sides of the equation. You have purchasers here in the United States who are navigating, they don't know who to connect with and who can be relied upon to deliver great resources, but also understand that the manufacturers are also very skeptical of who they can work with as trusted buyers, trusted partners that they can grow with and scale with, and ensure that in a marketplace where there is such enormous demand, that their resources and their time are being spent with reliable buyers as well. And so you see this across the board, and helping to bridge that gap is one of the things that we've been working on as a company at Zeel, and certainly I have individually. Another challenge that you see is that overnight we've seen all these new players come into the market, whether it be again manufacturers who have changed their manufacturing lines to focus on PPE and may have been in a totally different category, apparel or other type of manufacturing resources that are now focused on PPE, as well as sellers, folks who are brand new into the space who are trying to broker or sell PPE, who may not be familiar with the space and or the products that are available or how they should be handled. And also with that, you found that people are having to learn how to navigate China or the Asian markets, because as you will find, if there's any need for scale with PPE, all roads do sort of lead back to the Asian markets where production of PPE is happening at larger scales than what we see here in the United States, and where access to raw materials necessary to produce PPE supplies is also more available. So you have this mix of the blind leading the blind, because you have folks that are brand new to the space. And then you also have this need to become PPE professionals overnight. Understanding of products and supplies is one part of it, but also everything from understanding how to evaluate supply chains, like the raw materials, availability in certain markets and to certain manufacturers, as well as shipping and logistics. So it's a lot for any company to take on if you've had experience in procurement and evaluating products, but especially for those who are newer to the space.
Yeah, if you're if you're a spa owner, spa director, and right now we've talked to some of those folks, and a lot of those people are answering phones and booking appointments in addition to their roles of where they're trying to run kind of an entire business, and they may not have part of their staff might not be dedicated to doing exactly the things you just described, right? Looking at supply chains, looking at finding those credible partners, and looking for quality when they do that. And so they might, be operating, as you said, sort of blind leading the blind. They may be operating from a place of just a lack of knowledge really about what to do, where to look, and what to look for as far as those markers of quality. If a person is in that position, what steps can they take? What questions can they ask that, will lead them at least a little bit closer to that understanding that they're going to need to find stuff that's going to help their business?
Yeah. So my general advice on this particular question is, we can't expect people to become PPE experts. It's a bit too impractical. There are some organizations, some companies that have the resources to do so and can either contract or train folks internally to do some of that. But it's very difficult to ask those who are handling the day-to-day, especially small business operations, to become experts at evaluating product lines. There are a number of non-laboratory tests that can be done on products to ensure quality control. But I think more than that, reminding yourselves that your practical skills, your practical know-how on how to manage processes really needs to come into play here. And reminding yourself that working with individuals or teams that have a track record or have experience in the space is going to be much more efficient than trying to have somebody in-house learn about it all. So what I recommend to most is really look for partners that have experience, can prove that experience somehow, either by sharing with you their transactional history or have an existing kind of public track record of executing sourcing, procurement, quality control, supply chain management efforts. And I think organizations will be far better served doing that than trying to train internal folks in this very chaotic market that's moving at fast pace.
Yeah, and as we're hearing from folks inside the spa industry, like we said, there is so much else on the plate already, and really with any business, but obviously, trying to become an expert in something, like you said, overnight presents a whole host of challenges. And then you've got a subject that in and of itself feels, I'm sure, opaque to a lot of people, and they don't necessarily have a lot of confidence in looking for those things. because right now, we're there's still so much uncertainty. Trying to predict 2 weeks into the future when it comes to COVID-19 PPE, how any of this stuff sort of all fits together is kind of a fool's errand. But that said, it does feel like this is, for at least spas in most parts of the world. I know that we've spoken to some people in Southeast Asia who have a little bit more history with PPE as sort of a normal part of the experience. But for those folks who are trying to plan short term and long term, because we don't know about a vaccine, we don't know what the timelines look like for these things. When it comes to procuring and kind of keeping inventory ready and not overextending themselves, but also not being underprepared, how is it that people can kind of prepare themselves and strategize for some of those short and long-term plans when it comes to something like PPE, when there's so much uncertainty about the next 2 weeks, let alone the next 6 months or a year or whatever it is?
Sure, Josh. Yeah, and let me start with that final comment you made, which is there's a lot of uncertainty in the coming weeks, coming months, as companies, organizations make their way back into setting up shop or getting their workforce settled in. And so at Zeel, we really have 2 or 3 overriding philosophies that we communicate to our partners. First is there's a lot of learning that needs to be done in the initial weeks, months of returning back to your organization or company. And so we prefer that our partners be well resourced during that learning period. And the way to do that is to ensure that you can cost efficiently, time efficiently access the PPE sources that are required. And that is doable in this market if you're working with the right partners and you've identified the right help to access the resources you need. And so we want to be sure that our partners in the spa category have great resources so that their team members who are returning back to the workplace don't need to be concerned about, grabbing that extra supply or using a few extra pumps on the hand sanitizer or replacing a mask. You really need to be resourced effectively so that folks feel comfortable doing that, and it really keeps everybody safe. Or at least contributes to de-risking the space if you're resourced effectively. So first point on the short term is that we're going to be learning a lot. Let's remind ourselves that we need to give ourselves room to get back into the space, start operating and learning together before we start optimizing around which product lines we need. Second, we believe, all companies, brands are going to be distinguishing themselves with health and safety. And so we're trying to work with our partners to enable them with policies, with procedures, and of course with PPE resources so that their teams can feel comfortable, their workforce is feeling safe, and also they communicate that safety to their customers who are going to be looking to see how brands and companies are distinguishing themselves in that way. And then lastly, it goes back to something I mentioned earlier, which is the practical thinking. At Zeel, we've tried to become an extension from a quality control procurement standpoint for a lot of the companies that we work with and organizations we work with. We really want to be a turnkey solution for this need. And so that's relieved a lot of stress. One less thing everybody going back to work has to think of. And we would encourage you to find a partner that can do that, because it's really more practical in the short term, in the near term for the needs. Long term, I think nobody has the perfect crystal ball that can tell you where this is all going. But generally speaking, as I spend time with experts and folks who are evaluating, the big picture, obviously you can assume that prices and processes will stabilize over time. And so it will become easier to navigate. However, as much as we are all looking forward to a vaccine or other solutions for COVID-19, I think experts in the field, those who understand some of the public health implications of this pandemic, truly believe that there has been sort of a change to behavior in the U.S. And if you look at a lot of the Asian markets where this type of day-to-day safety and health precaution is a norm. I think we've taken some steps closer to that, and those steps are likely to be more permanent. So wearing a mask on a plane or in a spa, where it used to be taboo, is probably a lot more the norm for all of us going forward for the foreseeable future. So I think longer term, you want to be thinking about the processes and procedures that your facility in particular might need to have in place. You also want to be budgeting for PPE supplies long term, assuming that some of these changes are going to have a permanent effect.
Yeah, we have heard from some folks as part of the town hall series and the virtual chats that iSpa has done about things like flu season, where face shields and masks and all those sorts of things are becoming more normative during, COVID-19 and sort of right at this minute, but that those, as you said, might become a norm that sort of carries over into other situations, even if this particular, virus is no longer necessarily part of the chief concern, because it does make people more aware of being in that space and, not coming to work sick and doing things like that. And PPE, it stands to reason probably, will fall in line with that. We know from some of the recent snapshot surveys that we've done that really this is a chief concern for a lot of spa operators and owners. Number one is making people feel comfortable and safe back in the spa space, which you alluded to a minute ago. And right behind that are things like, sourcing and stocking enough PPE to make sure that they can have that supply on hand. And as you said, sort of have enough to get through that training and learning phase and figure out exactly what their needs are going to be sort of in a more consistent way. So people are clearly really concerned about, that the peace of mind part of it. And I would imagine that part of that comes with being able to speak to your guests, as you said, about those partnerships, about where it is that you are sourcing these items from them so that for them so that you can speak to the quality of it, because we know from some of our research that spa goers are going to ask those questions. They're going to want to know about your health and your sanitation and disinfecting steps that you're taking. They're going to want to know what policies you're putting in place to protect them, and they're seeing that as spas reopen and they go back in, and PPE is very likely to be a part of that. So stands to reason spa owners are going to need to know what to say. They're going to need to have those answers at the ready, because part of that feeds into that question of peace of mind.
Yeah, I have to agree. And I think, something that we can all reconnect to is that actions speak louder than words. As much as we can do in terms of putting up signs and communicating effectively to customers, at the end of the day, people visually take in a lot. And so being in a location where the indications around safety and PPE resourcing being available is really going to distinguish folks. And so we want to be sure that we're enabling our partners to, find resources that, have the track record and capability, that we guide them to make sure that they're, looking for market terms that are consistent in the market, so that there's no question that, you're working with suppliers that are way off the norm. And then lastly, we encourage spas and other partners to really evaluate what type of products they need in their space. In this time, there's been a great overcorrection, understandably so, around how partners are supplying themselves, in many cases paying much more than necessary for products, in particular those that are FDA certified or FDA approved, so that they can reassure themselves and their partners. And that's been great that there have been companies that have been willing to make those investments, but it may not be practical for scale and or ongoing resourcing. And so working with our partners that identify what type of specifications and or certifications they need around certain supplies that meet or surpass the safety criteria in their environments is really helpful, so that budgets can be managed appropriately and folks can be protected effectively.
Yeah, when I hear you say that, one of the things that comes to mind is sort of in the early days of the federal government in the U.S., at least, trying to get word out about, how to take precautionary steps if you're going to go to the grocery store, do whatever. And it was, here's how to cut up a t-shirt from, from your closet and make a temporary face covering. And in the context, something like that might work to go make a quick trip to the grocery store. But a massage therapist working, in close quarters with a client really wants to take every step, not only obviously from a quality and safety standpoint, but also that reassurance aspect that you were talking about, the visual cue and the aesthetic aspect of being made to feel at ease by what they're seeing in that space. And those needs will differ from place to place and profession to profession. So, when it comes to that kind of thing in a spa space where you might have a little bit closer contact, where social distancing in a massage therapy room is not really a thing that can happen. We still haven't figured out how to give massages from 6 feet away. What should those folks kind of be looking for when it comes to quality and being, obviously they need it to work and they need it to be that, but also being able to kind of send that message visually to the folks who are walking into their massage room and who might still be nervous
Correct.
and still have some hesitancy about stepping back in.
Correct. Yeah. No. And ultimately, every location, every organization will have to make decisions for themselves. It's one of the tougher things about this environment is that guidelines are being deferred to CDC, and we're trying to rely on some of the FDA investigators to give us input on sort of what are the safest places to turn to for our supplies. However, I think one of the best things a company or a spa can do is to evaluate each of the points of interaction some of their team members will have with the public, and what is the appropriate level of safety precautions in those scenarios. And so we've tried to work with our spa partners. One of the advantages we have at Zeel is that we've been in the environments, we've supported the operations, and so we can advise based on that practical knowledge. And I would hope that spas can either navigate that themselves or work with partners that have similar knowledge. Because to your point, it's a very different scenario to have a therapist working very closely with a customer versus a perhaps administrative level staff member who can still employ sort of that social distancing effort and be certain that the safety is in place, perhaps even with a mask. Something else that we've had to get familiar with in this environment is the differences between face coverings, masks, and respirators. And so understanding how respirators work, why they provide safety beyond what you might have in a fabric mask is really critical as well. I don't know if we're going to get into the details of that today, but certainly I would encourage those who are watching or receive this information to educate themselves on the differences so that they're utilizing the right things in the right places.
Yeah, as someone who's had to dive into some of those CDC recommendations pretty regularly, even reading that really, a face covering is, as we've kind of more broadly understand it, what you see people wearing in most cases technically is not PPE because it's protecting other people. And that's sort of the design there. And yeah, those differences in that education that you spoke to earlier, the level of training, just to know, right, the more that a group of people are outfitted with that understanding and that knowledge, the more confidence they're going to have speaking to guests, and the better they're going to feel, I think, themselves about understanding those kind of fine distinctions. We know from, like I said, our conversations that this is something that even though it's, as I said, 6 months ago, maybe nobody really had a clear idea about exactly, the depth of what they would be diving into soon thereafter. Now that the interest is there and the need is, because without fail, these spa professionals are looking at their business and they want to be back, but they will not do it without giving people that sense of peace of mind. They really want to protect their staff. They really want to protect their guests. And that's been, top of the conversation just every time that we've heard from folks. So I know that this information that, your insight is going to be really appreciated on that front. And before we kind of part here and break this, is there any sort of final parting guidance that you might offer? Because, as we've said, and you kind of covered, you're just not going to become a person with 18 years of experience in this overnight, and turning to people who you can trust and finding a trusted partner is going to be a big part of that. Is there any kind of parting guidance that you would offer to folks who are really trying to do their absolute best to protect their staffs and their guests as spas begin to reopening, and as spas begin to reopen, and as we see more uncertainty, more cases sort of showing up and questions being asked around that? We know this is not going away anytime soon.
Yeah, I think the best thing I can leave everybody with is just to recommend we all take a deep breath and calmly approach this challenge with level heads and the practical tools that we have available to ourselves. Not everybody's going to have a public health expert on their team. Not everybody has had somebody go into PPE manufacturing facilities and evaluate quality and supply chain. And so we have to use our strengths, and what you do find among our spa partners and small business owners or larger corporations is that they are resourceful, they're strong at their abilities to understand who they can or should be working with. And I would really encourage all of us to ask the hard questions that need to be asked to ensure that you have great partners in place. Try your best to work with folks who have experience, who have actually conducted meaningful transactions. Don't assume that the partner who may have been sourcing your towels, your hand lotions, etc. in the past are the appropriate partners for procuring your PPE supply. And know that you're not alone. Not only are there resources that are available to you, but also, every company, large and small, is having to face down this challenge. We've seen companies with tons of experience in procurement and supply chain management in a variety of industries now come to head with PPE and have to reach out and outsource for extra support. It's available to you. I know that we are putting out a great deal of education in the coming weeks to help our partners, and with iSpa, ensuring that folks understand what resources are available to themselves. But really, let's all keep a level head and remind ourselves that health and safety is first and the priority. And so we've got a collective community here that can help you ensure that.
Now that was an excellent segue. If I didn't know better, I would say that was planned, because we do have resources. If if you'd like to access those and you're watching iSpa's COVID-19 information on experienceispa.com, this video, as well as some of the other interviews that we've done with some health professionals and mental health professionals, will be on there alongside this, and hopefully some of that education that we can put out there as well, to give people as many tools as they can possibly use when it comes to this situation. Obviously, all hands on deck and all good resources on deck as well, so that people can put those into practice. Amir, thank you so much for sharing this with us and lending us your expertise for a little bit. We appreciate it, and we hope to, like you said, continue to kind of share good information with people and give them the tools they need to get back to work and hopefully do so in a safe and responsible way.
Thanks, Josh. Glad to be here, and hope this was a helpful resource for everybody working hard out there.
Excellent. I'm sure that it will be. Thanks again.